I'm Dr. Raymond Lam. I'm a professor of psychiatry and associate head for research in the Department of Psychiatry at the University of British Columbia. I'm also head of the Depression REACH, which is our Research, Education, Awareness, and Care Hub for CDRIN and CanMat. Well, I think that doctors are used to using questionnaires. It's just that it's hard for them sometimes to incorporate it within their practice. They may not have the questionnaires available. They may not have a way for the patients to complete them. And so by having the patients do it at home, at a time that might be convenient for them, we've also built in a reminder system, because it's very hard for people to remember to fill in questionnaires. So they can set a reminder, get a reminder by text or email for them to complete their questionnaires regularly. So I think technology is really a part of our lives now. We know from statistics that 65% of people own a smartphone. So they have their data with them all the time, and they're online all the time. Canada has very high internet use, for example, in most households. And so our online app can be used across many different devices. You can use it on your desktop computer or on your tablet or on your smartphone. All you need is an online connection, an internet connection. So in this way, I think people can use technology to better help them to monitor symptoms and to, like I say, have them participate in this measurement-based care. It's very important for clinicians to be able to best use this information that the patients are bringing into them. And so we are developing educational events for physicians, online webinars, for example, in terms of how to use the results from these mood trackers to aid in their clinical decision making. We want to evaluate how effective it is. Does it really help people to do better over time? Does it help clinicians better able to treat and again make some of those clinical decisions with their patients? So that's part of the research, is looking at that evaluation of the app to see how well it's working. We haven't linked this app directly yet to clinicians because most clinicians are not prepared to do that. Even those who have electronic medical records, it's very difficult to connect up from a patient app to an electronic medical record. Clearly, though, that's the way of the future, and more clinicians, doctors have EMRs, electronic medical records, and so I fully predict that in the next few years that will be possible to link up some of these tracking measurements with the actual clinician, and to be able to let them know how you're doing, and perhaps if things aren't going well, to be proactive in terms of getting into follow-up.